At some point in time, as you're considering bariatric surgery, you need to take in consideration, how much will this cost? What's my out-of-pocket portion? Majority of insurances do have bariatric benefits, but not all do. We will work with you at the bariatric clinic to determine what your out-of-pocket portion is, how much you'll be responsible for. Some insurances will require you to have weight loss visits. That varies between none to 3 months to 6 months. Some of them require so many visits within a time span. Some require them to be consecutive. So it's very important for us to work with you on your requirements so we make sure that you do exactly what they require. All insurances require a psychological assessment, a visit with the dietitian, and then we do a full assessment of you. If you need to have a mammogram, if you need to have a colonoscopy, we want you well when you have surgery. We don't want to have any underlying issues that haven't been addressed and then you find out why you're trying to recover from your surgery. If you don't have any insurance, we do have a self-pay package. That starts at the time that you have surgery. That covers the surgeon's fee, the hospital's fee, and it also covers the anesthesiologist. Anything else that is required beforehand, that will be due prior to surgery, but we do have a cash pay price. Most insurances require you to have a BMI of 35 or greater with a health problem. Some patients may not have a BMI of 35. You will still be a candidate to have surgery, so there are some patients that have bariatric benefits, but they don't have the BMI, so the cash pay package would apply to them as well. If you are unfamiliar with your insurance or you do not know if you have benefits, you can call your human resource person, your insurance agent, or your customer service number, and they can tell you if they have benefits. We also will work with you to determine what it is because we'll have to know what the specifics of. Some insurances may require you to have a history of a BMI of 35 or greater, and some do not. Bariatric surgery is considered an elective surgery. So with insurance, we will work with you to make sure that we meet their requirements, but we will also submit the documentation so your insurance will approve it. Once your insurance is approved, that's one less thing you've got to worry about because you know it will be covered. If you're interested in learning more about what's the next step, call 377-SLIM.